pregnancy is like no other time in your life. It's full of excitement, anticipation, even anxious waiting. In the next few minutes, we'll describe the changes you're experiencing. You'll see how rapidly your baby develops. It's truly amazing. We'll also show you how your health affects the fetus inside you and how the choices you make during pregnancy can help lead to a healthy baby.
If birth is a miracle, then words can't describe the wonder of pregnancy. It begins as a single cell, the size of a grain of sand. Over the 40 weeks of pregnancy, it will become a human being made of trillions of cells. From inside the uterus, we can observe the rapid and dramatic early development. At 4 weeks, the embryo is pea-sized, but there's a heartbeat. Arm buds begin the development of limbs. Eyes appear as black dots. By approximately 8 weeks after conception, a tiny face. The spine is clearly visible. Arms and legs are more distinct. A hand moves. By 10 weeks, the fetus measures less than 2 inches. You can see the early formation of an ear, well-defined fingers, toes, and a sex organ. But it's too early to tell whether this will be a boy or girl. All organs form in the first trimester. The fetus takes shape. Karen found out she was pregnant just last week. Since then, she and Ron have been caught up in the excitement. An addition to the family, lots of attention, new responsibilities. Like most expectant parents, Karen and Ron also face big adjustments. A change in lifestyle, economic pressures. It's normal to experience a range of emotions during pregnancy, with mood swings, especially if you're not feeling well. Most expectant parents are excited, but some feel apprehensive too. Having a baby will change your life. Enjoy the excitement. Accept the adjustment. Support each other and build confidence for what's ahead. And know too that you can rely on your doctor and nurse. Outward physical changes during the first trimester are subtle and barely noticeable. But soon after conception, your body begins adjusting to support the fetus. You may feel tenderness as your breasts become fuller. The urge to urinate may increase, and you may tire easily. The changes taking place inside you can produce equally dramatic reactions. Some expectant mothers experience queasiness, nausea, and vomiting. This morning sickness can happen at any time of day, and usually subsides by the end of 3 months. If you're concerned over changes in your body or bothered by symptoms that accompany them, talk with your doctor or nurse.
Okay. I see from your personal history that it sounds like you've been pretty healthy.
The first doctor visit should take place as early as possible. Your doctor will review your medical history and perform a thorough examination. She can detect and treat any early concern before it becomes a problem.
And I see diabetes in your family history. Who in your family has it?
My sister has diabetes.
Okay.
Your doctor will also determine which prenatal tests are needed to plan your care during pregnancy. Now is also a good time to talk about any problems you may be having. Here are a few tips. Always provide complete and thorough health information. Write down questions and bring them to your next visit. Ask your doctor to explain the results of any tests you have. Find out which complaints you should report right away, like vaginal bleeding, abdominal pain, or dizziness.
These early visits are important. It's a time when your doctor develops a plan for your entire 9-month pregnancy. As long as things go well, you'll continue to see your doctor once a month during the first 28 weeks, then every other week during weeks 28 through 36, and finally weekly until you deliver. So much happens inside you during the first 3 months, including the development of your baby's heart, brain, and other organs. Many of the choices you make in your daily life affect this development. It's true for things you should do, like exercise, eat healthy foods, and get enough rest, and for things you shouldn't do, like exposing your fetus to drugs, alcohol, and cigarettes.
The umbilical cord links the fetus to its life support system, the mother. It carries blood and nutrients to the fetus. It also returns blood and waste products to the placenta. Whatever you consume, good or bad, passes through to your fetus. Smoking, drugs, and alcohol threaten your baby's development. Smoking tobacco decreases blood flow to the placenta. Blood vessels clamp down, reducing oxygen to the fetus. Smoking also increases the passage of carbon monoxide. Both of these changes speed up the fetal heartbeat. Smoking increases the risk of stillbirth, miscarriage, and low birth weight babies. Illicit drugs can pass through your system in 24 hours, but they can linger with your fetus for up to 14 days. Your baby can be impaired and even born with your addiction. Studies link drugs with miscarriage, birth defects, low birth weight, and even sudden infant death syndrome, the #1 cause of death in the first year. Its risks increase by 80 times when the mother takes cocaine, by 40 times with heroin. When a pregnant woman drinks alcohol, it quickly reaches the fetus. But like illicit drugs, it takes longer to leave. While the risks increase with heavy and frequent drinking, there are no safe amounts. Drinking alcohol can cause fetal alcohol syndrome, birth defects, low birth weight, and mental retardation. Organs form during early pregnancy. Drugs, alcohol, and smoking threaten this development and stunt growth. You need to stop right away. Often by late pregnancy, the damage has been done and is irreversible.
Drugs, alcohol, and smoking can threaten your health, and now they threaten your baby's health too. If you are using any of these substances, stop now. I know this can be difficult. These behaviors are often addictive and hard to control. So get help. Join a support group and talk with your doctor about quitting.